Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. Today we are here with the classification of joints part 3. Let's start today's video. In last video we have already started the discussion regarding structural classifications of joints. In this video we will continue the rest part of this structural classification. We have already learned that structurally joints can be classified into three types: fibrous joint, cartilaginous joint and synovial joint. In last video we have already covered fibrous joint and cartilaginous joint. Let's move with synovial joint. Synovial joints are the most common type of joints in human body, and it has a key structural characteristics, that is a presence of joint cavity, which is absent in fibrous joint and cartilaginous joint. And synovial joints are the freely movable joints, and these joints are composed of the following structures like articular capsule, synovial membrane, synovial fluid and articular cartilage. Let's discuss each structures in details. First is the articular capsule. Articular capsule surrounds the joint and is continuous with the periosteum of articulating bones. It consists of two layers: fibrous layer or the outer layer and the synovial layer or the inner layer. The outer layer consists of white fibrous tissue known as the capsular ligament, and it holds together the articulating bones and support the underlying synovium. And the inner layer is a highly vascularized layer of serous connective tissue. It absorbs and secretes synovial fluid and is responsible for the mediation of nutrient exchange between blood and joint. And this inner layer or the synovial layer is also known as the synovium or synovial membrane. In this picture we can see there is a joint cavity which is filled with synovial fluid, and the outermost layer, that is the sky color layer, is the fibrous layer of the joint capsule, and the orange color layer is the synovial layer of the joint capsule. Next is the synovial fluid, which is located within the joint cavity of a synovial joint and secreted from synovial membrane. It has three primary functions, that is lubrication, nutrient distribution and shock absorption. In this picture we can see the joint cavity is filled with synovial fluid which is secreted from synovial membrane. Next is articular cartilage. The articulating surfaces of a synovial joint are covered by a thin layer of hyaline cartilage, which is known as articular cartilage. The articular cartilage has two main roles. First is minimizing friction upon joint movement, and second one is absorbing shock. In this picture, we can see a sky color covering of a thin hyaline cartilage in the articulating surfaces. And this hyaline cartilage covering is known as articular cartilage. Let's discuss the accessory structures of a synovial joint. First is the accessory ligaments. The accessory ligaments are separate ligaments or parts of the joint capsule. They consist of bundles of dense, regular connective tissue, which is highly adapted for resisting strain. This resists any extreme movements that may damage the joint. hip joint is a example of synovial joint. So in this picture we can see in the hip joint anteriorly we can see the iliofemoral ligament and pubofemoral ligament, and posteriorly we can see the ischiofemoral ligament. So these iliofemoral, pubofemoral and ischiofemoral ligaments are the accessory ligaments in case of hip joint. Next is bursa. Bursa is a small sac lined by synovial membrane and filled with synovial fluid. These are located at key points of friction in a joint. They afford joints greater freedom of movement whilst protecting the articular surfaces from friction induced degeneration. Next, a tendon sheath, which is similar in structure to a bursa, but it is smaller. It is a connective tissue sac that surrounds a muscle tendon at places where the tendon crosses a joint. It contains a lubricating fluid that allows for smooth motions of the tendon during muscle contraction and joint movements. Next is articular disc. In few synovial joints, the cavity may be partially or completely subdivided by an articular disc or meniscus. It is a fibrocartilage structure which is located between the articulating bones. An articular disc may act to strongly unite the bones of the joint to each other. It can provide shock absorption and cushioning between the bones, and also can serve to smooth the movements between the articulating bones. Let's discuss the nerve supply and blood supply of synovial joints. Synovial joints have a rich supply from articular nerves. Articular nerves transmit afferent impulses including proprioceptive and nociceptive sensation. And in case of blood supply, arterial supply to synovial joints is via articular arteries, which arise from the vessels around the joint. The articular arteries are located within the joint capsule, mostly in the synovial membrane. And the articular veins accompany the articular arteries and are also found in the synovial membrane. Next, coming to the types of synovial joint. Synovial joints are further classified into 6 different categories on the basis of the shape and structure of the joint. That are pivot joint, hinge joint, saddle joint, plane joint, condyloid joint, and ball and socket joint. The shape of the joint affects the type of movement permitted by the joint. Let's discuss each types of synovial joints. First is plane joint or a planar joint. Planar joints have bones with articulating surfaces that are flat or slightly curved faces. These joints allows for gliding movement, and so the joints are sometimes referred to as gliding joints. The range of motion is limited in these joints and does not involve rotation. Examples: the fascious joints of the spine, intercarpal joints of the wrist, intertarsal joints of the midfoot, and acromioclavicular joints. So in this picture we can see there is a plane joint between navicular and second and third cuneiforms of the tarsus of foot. Second one is the hinge joint. The slightly rounded end of one bone fits into the slightly hollow end of the other bone. In this way, one bone moves while the other remains stationary, like the hinge of the door. The hinge joint allows the movements like flexion, extension. As an example, in this picture, we can see the elbow is an example of a hinge joint. And the knee is sometimes classified as a modified hinge joint. Third one is the pivot joint. Pivot joints consist of the rounded end of one bone fitting into a ring formed by the other bone. This structure allows rotational movement as the rounded bone moves around its own axis. As an example, in first picture, we can see the joint of the first and second vertebra of the neck that allows the head to move back and forth. And in the second picture, we can see the joint between radius and ulna. It allows the twisting movement of the radius and ulna against the upper arm. Fourth one is the condyloid joint. Condyloid joints consist of an oval-shaped end of one bone fitting into a similarly oval-shaped hollow of another bone. This is also sometimes called an ellipsoidal joint. This type of joint allows angular movement along two axes. So, the condyloid joint allows the movements like flexion, extension, abduction, adduction and circumduction. So as an example, we can say the radiocarpal joints of the wrist. So in this picture, we can see the condyloid joint between radius and scaphoid and lunate bones of the carpus. And apart from this, the other examples of condyloid joints are the metacarpophalangeal joints of the hand and also the metatarsophalangeal joints of the foot. So fifth one is the saddle joint. Saddle joints are so named because the ends of each bone resemble a saddle with concave and convex portions that feed together. Saddle joints allow angular movement similar to condyloid joints but with a greater range of motion. The movement allows that are flexion, extension, abduction, adduction and circumduction. Example of saddle joint is the thumb joint, which can move back and forth and up and down, but it can do more freely than the wrist or fingers. So in the picture we can see the thumb joint that is formed by trapezium and metacarpal of the thumb. Sixth one is the ball and socket joint. Ball and socket joints possess a rounded ball-like end of one bone fitting into a cup-like socket of another bone. This organization allows the greatest range of motion as all movement types are possible in all directions. All movements like flexion, extension, abduction, adduction, rotation and circumduction. As an example, we can say the shoulder joint and hip joint. In this picture, we can see this is a picture of hip joint. It is a ball and socket joint which is formed by cup-like socket of the acetabulum of hip bone and ball-like head of the femur. The next part, that is the last part of this topic, will coming soon. If this video is useful for you, then please put a like and share it with your friends. And for getting more videos like this, you can subscribe my YouTube channel or follow my Facebook page, that is NG's Corner for Nurses. And for any queries or suggestions, you are most welcome to comment. Thank you for listening.